Alright, so today I'm going to show you how to do COVID-19 rapid test to check if you have COVID. This takes 30 minutes to complete. The test itself takes around 2 minutes or less. But you have to wait for the results to appear within 30 minutes. Sometimes it appears before, but it is recommended that you wait for at least 30 minutes to ensure that the result is final or for the test to complete. Yeah, the 30 minutes. Right. So this is the pack. I've been doing this for months now because I work in a school. I have to do it at least twice a week. So I do it Sundays and Wednesdays. Right. So you open the pack. Make sure the pack is sealed. So you can see that mine is sealed. See that little plastic thingy? Both sides. So nobody has messed with it and put anything in there that you don't want. Plastic off. Kind of hard. Just need to take it off of one side. When you open it, oops, something drop out. You get these little containers. You get this box. So this box is where you put the container to hold after you've done the extraction. Yes, you're gonna extract some stuff from the back of your throat and in your nose. And this is the liquid that you place it in. So I'll show you all of this in a minute. I'll just unpack everything. This thing also comes in the boxes. Quite a few of them comes in the box, lots of them. So, right. Now, you need to get everything out this box. So lots of these things come in there. Plastic bags to dispose of the things after you've used them. Disposable sampling swab. So quite a few of them come in the box. I'll show those in a minute up close. And more COVID-19 test. Whatever that thing is. So you need to close up this box. You're going to put it on a flat surface and you're going to put the thing inside here. So put that down on a flat surface. I'll put it on my window. Well, my window is a bit sunny, so I'll put it here. Right. Then you need to get one of these. And you're going to put that into here, like so. So this is where you're going to squeeze this thing in. So I'll open this. You get one out. And you're going to squeeze it into this container. So you ring this top, hold it, ring it off, and then squeeze it in there. Then, this is what is this thing called now? Well, this thing doesn't have a specific name. Well, it maybe. Can't be bothered to read it. So it looks like this. Looks like this. It has a QR code right here. And it has a number. Don't know if you can see it from where you are. And this is where you squeeze the thing on. And then if it is C by itself, it is negative. And if it is T and C, it's positive. So the booklet with instructions here. So I'll just quickly look at the results bit to tell you. What is important, C stands for control. And one line next to it after 30 minutes means that the test is negative. So you have to wait for 30 minutes. Now, C means that C stands for control, which means that the device is working. So that means it's working. And then you have to wait to see if the T pops up after 30 minutes. So the T stands for test, which will return a line if you have COVID symptoms. Please wait for 30 minutes before you confirm whether you have a positive result or not. So this is what a positive result looks like. You can see both the control line and the test line red. And it is void if it's just T by itself. So it's similar to a pregnancy test. Right. So let me just clear the area. So I'm gonna take this off. So you twist the top off. And then you pour it into the container. They say try not to make the thing touch. Right. So that's in there. Yep. Make sure that goes to the bottom. Then you get the swab. Swab. Tear off one. And then you look for the end. So this is the sponge end that you will put in your throat and your nose. And this part says open. So you find this part. You open it. Pull it out. And then this is the part I hate. I hate sticking stuff in the back of my throat. And then the same thing you stick in the back of your throat, you're going to have to push up in your nose. And swab around 10 times in your nose and 4 times on both ends of the back of the throat. So here goes. Well, it touched the back of my throat, my start. It's my item. Right now, the same thing now must go in the back of your nose. Don't push it too far, but far enough to get some mucus and stuff. Oh. This, I hate this. I don't know if everybody have this reaction, but it makes my eye run water. It tickles so much. I will feel this for days. All right, so you need to do it like 10 times around. Swab it around like 10 times as much as I don't think I did enough, so I'm gonna go again. Oh. All right, I think that's enough for me. I can't do anymore. You shouldn't do it from both sides or both those nostrils. Just do it from one. Then you need to get this, push it down in it, hold the bottom end, squeeze, and twist to make sure you get all the stuff you got from the back of your throat and in your nostril in it. You twist and squeeze it so that you squeeze the things off in the liquid. So you can see the liquid, and then so I'm gonna squeeze it now and twist it to rub it off in there. And then I put it down, put it in that. Now you need to dispose of all the things that you used. So you get the plastic bag and you put this in there. Just put all the rubbish in there and seal it and throw it in the bin, the regular bin. Just make sure you put everything in and you don't leave any liquids or stuff from your insides around for your kids or anyone else to come and touch, just in the event that you have a positive reaction. So this goes in. Then now we need this. So you're gonna make only 2 drops onto this part. So you put it on a flat surface and make only 2 drops. So I'll show you that part next. So after you've done that, you need to take this You need to seal the cap. Try not to touch the end because you don't want to contaminate it, and I would recommend that you make sure your hands are clean. Then you need to drop only 2 drops on the part that says S. So 1, 2. And put that back and you wait for the results. So at this point I'll pause the video and wait for the results to appear. It should appear fairly quickly, but normally the thing says that you should wait for at least 30 minutes. Please remember to you must wait 30 minutes before your results is ready. So C indicates a negative, these 2 indicates a positive, and just the T at the bottom would represent a void test. So that means you probably would have to do it again. All right, so I'm back 30 minutes later, and as you can see the result here, and just to see, it's negative. So I don't have COVID-19, and I'm quite happy about that. So what you do now is, this is your plastic bag that you got to dispose your stuff in. So you just make sure you don't spill any of this thing, and you put it in the bag. Now what you need to do is take this and scan the number, or scan it, get the number, and report it to NHS. I'll show you how to do that in a sec. Okay, so after you've done your test, you need to report your results to www.gov.uk report COVID-19 results, so you can see the information there. Click go. When it comes up, you click on start now, and you report it for yourself or on behalf of someone else. You sign in, so each person in the UK would need to sign up. If you are a UK resident or so, you would have your account, you can fill in your details to get to it. Once you're logged in, you would then click agree and continue. You then click report COVID-19 test results. You choose the appropriate selection based on your data. I work in a school, so I'm going to click school, continue, put the day that you've done the test, and click continue. The test number, I'm simply going to get it from the device, so I'm just going to scan it. The number is on it, but I'm a bit too lazy to read it and type it, so I'm just simply going to copy it. I'll paste it, and this way I don't make any mistakes. Continue, and then you choose the result, and then you click report. It will ask you to confirm your details, and that's how you do it.